Good morning, everyone, and thanks so much for joining us for this news conference. Joining me here today are Lincoln Police Department Chief Michonne Morrow, CenterPointe President and CEO Topher Hansen, Downtown Lincoln Association President and CEO Todd Ogden, Lincoln Police Department Homeless Outreach Coordinator Melissa Ripley, and CenterPointe Homeless Outreach Coordinator Matt Martinoski. And I don't think we have any other City Council folks with us today, but I want to thank them for their participation in this announcement as well. The City of Lincoln and our police department are committed to using a multifaceted approach to ensuring the health and safety of all of our residents. Not all calls for help from our first responders, though, are alike. Some of those calls to LPD require immediate law enforcement action, while others are best handled with crisis and social services support. When it comes to protecting the health, safety, and well-being of our community and those with whom the health and well-being of unsheltered members of our community and those with whom the unsheltered interact, the city for a number of years has helped to fund, and in our most recent budget, we stepped up our financial support for CenterPointe's street outreach efforts. CenterPointe's street outreach team includes peer support specialists who help people experiencing homelessness by connecting them with a range of community resources. And as evidence of the city's commitment to an effective, compassionate, and solution-oriented response to calls for service involving people experiencing homelessness, LPD has innovated and developed the Alternate Response Program, a new approach in partnership with CenterPointe. I am so proud of what LPD has created with our partners, and we're excited to share more about that with you today. So first up, I'd like to invite our Chief, Michonne Morrow, to share more specifics about how this new approach will benefit our officers and compassionately address calls for service related to our unsheltered community members. Chief Morrow?
Okay. Thank you, Mayor. Good morning. Every day, the men and women of our Lincoln Police Department carry out community-based policing on our streets, in our schools, and most importantly, with our residents to identify and implement effective solutions to specific challenges. As a member of our department for more than 25 years, I know firsthand how important community partnerships are in keeping our residents and our officers safe and healthy. During this time, I've also seen the positive impact of the department's partnership with CenterPointe in the lives of both our dedicated law enforcement professionals and the most vulnerable in our community. Our new alternate response program has multiple benefits. It allows our dispatchers in the Lincoln Emergency Communication Center the ability to determine the appropriate level of response when handling calls regarding unsheltered individuals. It enables our partners at CenterPointe to provide compassionate outreach and basic care in cases where our unsheltered residents do not need medical attention and are not violating laws. Finally, by redirecting these calls for service to the community partners who can best address the human service needs of our unsheltered individuals, our officers have more time to focus on calls requiring law enforcement.
Thank you so much, Chief Morrow. For decades, CenterPointe has helped Lincoln be a community that supports the well-being of all our community members. And I'd now like to invite up CenterPointe President and CEO Topher Hansen to share more about the organization he leads and how his team complements the work of our public safety professionals. Topher?
Thank you very much. I appreciate being able to be here. I also appreciate the forward-thinking leadership that you have provided, Mayor, and that you have provided, Chief Morrow, on doing these kinds of services that really line up with the kind of approach that CenterPointe has, which is meeting people where they're at. So stepping in and not having a judgment, but really meeting them in their circumstances to help them take those steps to getting better. We have 5 people who work full-time in helping people who are unsheltered to get connected to services so they can start to live a life of health and well-being rather than have illness and struggles trying to maintain their illness without support. So we are really excited to be able to do this and to partner in a deeper way with the Lincoln Police Department and City of Lincoln. CenterPointe helps the people that we serve get better, sooner, for longer. And sooner means at their rate, how fast they can go. And we want to do it really well the first time so they don't have relapse, and so they aren't in a continuous cycle. So we address the whole person that way and attend to their primary care needs and to their mental health and substance needs, as well as provide housing and basic needs to address the issues they face. So this fits perfectly into our mission in the community and to deepen our relationship not only with Lincoln Police Department but the City of Lincoln to address the needs of the city in an appropriate way. So to bring in people who are being able to attend to the specific needs of the person unsheltered, and so we have officers that are freed up to do the work they need to do rather than this work, which is more appropriate to organizations like CenterPointe and others that are doing street outreach. So again, my thanks. Thank you for forward leadership and thinking, and we look forward to this as a great partnership for the City of Lincoln.
Thank you so much, Topher. Our new alternative response program requires the expertise of personnel trained in outreach to vulnerable populations. And earlier this year, longtime LPD investigator Melissa Ripley became our department's new homeless outreach coordinator. Investigator Ripley, thank you so much for your leadership and your vision in developing this new program. We're excited to hear from you. Could you please share more about this with everyone?
Thank you, Mayor. First, I just want to thank Chief Morrow and Captain Copsa for their support in making this program happen. Without their willingness to try something new, the alternate response would not be possible. These kinds of projects are always a team effort, and I couldn't have done it without them. Traditionally, after receiving a call regarding unsheltered individuals, LPD would send 2 officers, even though no law violations were being committed and no medical treatment was needed. The alternate response program will now divert those calls to the CenterPointe street outreach team, who will respond to ensure the person has their basic needs met, but also connect them with homeless outreach services. By diverting these calls, the new program uses LPD resources more efficiently and allows for a compassionate interaction with one of Lincoln's most vulnerable populations. Often, those experiencing homelessness also experience the stigma and shame associated with being unsheltered. Having uniformed police officers contact you repeatedly when you're not doing anything illegal can contribute to that shame and that stigma. This new approach creates a more dignified response to contact people while still accomplishing the same outcome. People are also much more likely to accept help from a street outreach worker rather than a uniformed police officer. Matt Martinowski and I have worked together for the past 13 years and have always wanted to create a program like this. And as the new homeless outreach coordinator for LPD, I was able to collaborate with Matt and his team to create and implement this program in our community. CenterPointe already had the street outreach team in place, so we were able to work through the logistics on the LPD side, and the street outreach team was already in place, ready to go, making this a very smooth transition.
Well, again, thank you so much, Investigator Ripley, for your work to make this dream and vision you had become a reality. Our team is also incredibly grateful to the talented team at CenterPointe for the incredible work they do every day, as you heard Topher say, to meet our community members where they are and to support their health and overall well-being. And CenterPointe's homeless outreach coordinator, Matt Martinowski, is a leader in this partnership. Matt, thank you for all you do and have done over the years. Would you please come share more about this program and how you've helped shape it?
Thank you, Mayor. I also want to thank everyone that's up here, but also Copsa and Amber Dirks. I've had the honor of working closely with each of you over the past decade, and to see the changes we've made in the community and will continue to make to better serve the unsheltered has been truly an amazing thing. The CenterPointe outreach team consists of Kate Michael, Alec Duncan, Santana Fritz, Natalie Derman, and Lewis Flesher, who's our outreach nurse. They're an incredibly compassionate group focused on building relationships with those in our community who are often ignored or looked down upon. The drive to advocate for the unsheltered is the backbone on which this new program can and will succeed. The CenterPointe outreach team's focus is 100% in the community, meeting people where they're at, to provide human-to-human support, basic need items, and access to many of the resources some of us may take for granted, whether that's through CenterPointe or any of the other community providers we closely work with. This new alternate response gives both CenterPointe and LPD an opportunity to react more compassionately to concerns regarding unsheltered while helping to decriminalize homelessness and allowing outreach to stay in constant contact with the people we are working with so that they aren't missing out on any opportunities that they may be given. Thanks.
Thank you, Matt. Next up, we're going to hear from Downtown Lincoln Association President and CEO Todd Ogden. Todd works every day to serve the needs of our downtown residents and businesses and to make life better in Lincoln for everyone. Todd, thank you for your leadership and partnership. You've been a vital part of this work too, and we'd love to hear more from you about what this program means for the Downtown Lincoln Association.
Thank you, Mayor. Yes, thank you, Mayor. As a part of the Downtown Lincoln Association, we're just so thrilled to be able to work with everybody here and everybody in the community through the Homeless Coalition, CenterPointe, our police department, the mayor's office, and all of the city. We're a part of what's called the International Downtown Association, and that's a group of downtowns like ours from all around North America and even the world. And every time we talk about these issues come to the top of everybody's priorities. And for us, we are the envy of a lot of these communities because we are so fortunate to have all of these organizations come together to figure out the best solutions for everybody involved, and not only downtown, but the entire city. I've seen firsthand with our experience with CenterPointe, and we've worked with them over the last half decade, and the amount of people that we've placed downtown, the amount of people that have been interacted with has made us much more efficient. It's made us much more kind. It's made us put us in a position where our police and our community can work together, and the willingness for them to do that is, to me, unmatched. So we so appreciate everything that the mayor's office has done, the city, the police, CenterPointe, and all of our outreach partners, because this is not an easy thing. This is not easy solutions when you want to make sure that your areas stay safe and vibrant at the same time. So we want to make sure we continue to partner like this, and I'm just thrilled to be able to be a part of something where people work together. I think that's what Lincoln is made of, and this is the exact example of why we're such a great city and will continue to be so. So thank you.
Good, that was a mic drop. I'm really, thank you for that. We appreciate your partnership. This entire partnership really exemplifies our shared commitment to connect unhoused individuals to vital community resources that address their needs, and that's helping to foster a safer community for everyone. Before we close, we'd be happy to take any of your questions. There's lots of people with a lot of expertise up here who'd be happy to share more. Yes?
So this is probably for LPD. Can you give a little bit of insight on maybe what those calls kind of were? If, people aren't breaking the law and there's no medical, necessity to a call. What are people actually calling for that LPD would have to go out for in these instances?
For Melissa and her expertise to come up and address your question.
We oftentimes get calls just to simply check on people, check their welfare. People will be driving by and see someone sleeping on the sidewalk or laying under a blanket, or especially when the temperatures are very high or very low, and people don't know who else to call. And so we get those calls, and they may not be committing a criminal law violation or really be in need of any kind of medical assistance. And so rather than having uniformed police officers go out and contact them, now we have our outreach team who can do that instead.
I'm not sure if the city does a point in time count or if that's been done when that was most recently done. What's kind of the number that we're looking at in terms of this population?
Point in time count happens typically in February, but is this a question, Topher, you feel comfortable answering, or Matt, do you want to?
That would be better than me.
Okay.
I had just looked up this data the other day, so obviously I've forgotten it right now, but it's, I believe it was, the total number of people sheltered or on the streets was 429 this year, I believe, which is slightly down from last year, but I don't remember what last year's is exactly.
When you do meet these people, is there any one particular service that they are asking for or may need, or does it just vary case by case? I'm not sure if you're hearing any one particular thing maybe more than another, when you go out on these calls?
On the calls, for the calls, it's a variety of things, basic needs. A lot of the people we're interacting with so far on the calls are people we've already known for quite some time. So we're working on housing, we're working on driver's license, social security, things like that they might not have access to while being on the streets. Housing is a big one though.
I'm going to jump in and clarify.
Yeah.
So let me add a sec to Matt. So while the point in time count is the number he quoted, a year ago, CenterPointe saw 4,417 people, and 57% of those people made less than $1,000 a year. So that the answer to that the question is, how much did you make? 0 to 1,000, and that 57% of that 4,400 said 0 to 1,000. So that means nothing. So while our point in time count can, as best as we all can do it, go out and identify who is unsheltered at that time. If you're making less than $1,000 a year, you're probably sleeping at somebody else's house or unsheltered in some other way. And so the number is probably higher. We see quite a lot of that.
You guys are using the term unsheltered people. Well, also seems like you guys are using the word homeless as well. Can you kind of define what those two are? Are they different? And if they are, kind of explain what those two words mean separately?
Do you want to tackle that?
Sure. We use a person-centered language just so that we aren't defining someone by their housing status. Language is important, especially when we're out approaching people and talking to people. Unsheltered versus homeless is just a very softer feel. It's just trying to break that stigma again and that shame that comes with living on the streets. And so it's just a friendlier approach, and just it really is just more person focused rather than their housing status. Do you want to add anything?
I'll ask one more question here. Do you have any? Okay. I've worked in cities where homeless populations are quite large. And there's a group of people that tend to be unwilling to take services, or they prefer this way of life. When you encounter that, what is that conversation like, or how do you handle that?
That's a great question. Do you care if I? No, please. Basically, we understand that there will always be a group of people that may not accept services. We still try, and we still, meet them where they're at, still provide basic needs, whether that just be a bottle of water sometimes, or whatever they need to survive at that point in time. You never know at what point they will accept services, so we keep trying. But again, there's no judgment. If that's how someone chooses to live, that's how they choose to live. It's not up for me to decide if that's right or wrong.
Got something to add?
Yeah, please do.
Yeah, I do think that's a really great question, because for us too, when there's a number of calls, just having somebody who can filter out what the needs are, especially for our downtown businesses and residents, they don't know what situations we're working with. So we're really thrilled that they're able to kind of assess, do they need peer-to-peer support? Is this an issue? And more importantly, it's not just educating our unsheltered community or our loitering community or anybody that we don't want to clump in together, but educating our downtown businesses and residents on the best way to approach this. And again, that's why this is so important, because you have one number you can call and filter out through the rest, and that's something we'll look to push. But educating our businesses and residents has been huge for us, and it's really helped the situation moving forward. Yeah.
So the other piece about all of this is the magic in outreach or in providing treatment or those kinds of things is relationship. And the first thing you have to do in a relationship is engage with somebody and begin to build trust, and then continue that by being trustworthy. And so the bottle of water is maybe the first step, and then the continued communication, and you begin to build trust. Nobody who is out on the street is reporting to be super happy, really a fun day today. That's not happening. And because they're struggling through illness of some sort, and have some cynicism about the system that they've dealt with over the years, then they might have a big reluctance to rely on anybody else. So we're building those relationships to help them engage in services and begin to take the baby steps towards getting better. And it starts with that person-to-person, non-judgmental contact in the community.
If somebody were take, you go ahead.
One last follow-up on that question, and thank you for that, and thank you for all the information you all have provided. And in recognizing the need to provide additional infrastructure in our community to support the chronically homeless, one of the steps that we have been undertaking as a city is to utilize some federal funds to develop a permanent supportive housing shelter so that there is an opportunity for people experiencing homeless in a more chronic way to choose to take us up on that resource where they can connect to wraparound services like those that CenterPointe provides. So that is a longer term strategy, not the subject of this news conference, but also something, one of the other facets of our approach to ensuring the health and well-being of people experiencing homelessness. Yes.
Sorry for interrupting. If somebody were to accept service, you get called out and you guys go out there and somebody were to accept service, is there a fee associated with that service, or are they going to be getting that service free of charge?
So again, CenterPointe, this last year we provided services to over 4,700 people. The year before it was 4,400. And still the preponderance of people make less than $1,000. It was 0 to 1,000. So most people don't have money for services, but what we do is then utilize state dollars through Mental Health and Substance, the Division of Behavioral Health, or we get them connected to Medicaid, and so they have health insurance then, and begin to just build their resources by connecting them to the opportunities to get services. And so we serve regardless of their ability to pay, and do everything from commercial insurance to Medicaid to Medicare to indigent care, meaning they have no resources and we have to go to the Division of Behavioral Health dollars. So we have a whole panoply of funding sources because what we know is people don't get better on the street. They need, as Maslow told us, food, shelter, and clothing. And then we can't have pay be one of those barriers. And so that's how we begin to serve and access the resources available in our state and local community to get the job done.
And the city has been an important investment partner in this project, and we stepped up resources in our most recent budget for the street outreach work. So again, we're a lot of people coming together to make these investments that have really important dividends for everyone in our community.
And once CenterPointe is called, if you get there and you realize it's more of a dangerous situation, do you then call the police? And then what's the deciding factor between that?
LPD, take that?
Or did you want?
No, feel free.
Oftentimes we already know the individual, and it's a lot easier for us to de-escalate situations, having built those relationships and also showing up looking like this as opposed to looking like this. No offense.
It's okay.
That did come up yesterday a little bit. There wasn't a situation that was terrible, but the conversation was had with LPD about how to respond to some of those situations, and we would reach out to them, or I would start with Officer Ripley first, and then that would carry on from there. But like I said, oftentimes, anytime we get called out, it's usually something may be happening, we show up and it's just, oh, hey Matt, and it just kind of stops immediately. So I don't know if that answers your question, right? Okay.
What is the procedure like? So a call comes in to the 911 or the non-emergency line. Where does it go from there? Does that person calling get routed to CenterPointe, or does dispatch then take the information and route it to CenterPointe? How does that kind of work?
You want to talk on the receiving end? I can talk on it. So I want to lift up our emergency communication center because they put a lot of legwork into this for it to be implemented for us. This was a new strategy for them and a new protocol system for them to put into place on being able to work through these calls for service when our community member calls in and is asking for assistance with somebody who is experiencing homelessness, is unsheltered in our community. So they have a set of questions that they're asking to make determinations that to ensure that there's not a law violation going on at that point in time, that they don't need medical attention. And then if we have discerned that it is simply that we need to check on this person's well-being, they are taking that call for service, putting it in a queue that then sends out an alert to our friends at CenterPointe, to the outreach. And I know that they have already had experiences. We hit go on this week, and so I don't know, I know they've had several calls. If you want to share some of those calls or numbers of what that looks like so far.
So we started this at 7 a.m. on Tuesday morning, and since then I believe we've had 10 calls. So it might not sound like a lot, but that's 10 calls that we didn't have to have 2 uniformed officers respond to, and that we were able to get out and get in contact with people who needed services, and we were able to find them and get them what they needed at the time. So in just the short time that it's been up and running, it's ran very smoothly. It's ran exactly how it was supposed to go with the dispatch center, and everything is working as planned. So
I apologize if I missed it. How large is this team? Or do we have kind of a head count? Or?
There's 5 of us on the outreach team, plus an outreach nurse and an outreach therapist.
Okay. All full-time positions?
The therapist and the nurse are part-time positions.
Any other questions? Okay, well, thank you so much for joining us for today's announcement of our new alternative response program. This collaborative initiative between the Lincoln Police Department and CenterPointe's outreach team demonstrates our shared commitment to compassionately address calls for service regarding people experiencing homelessness. And this new program that empowers our emergency communications center dispatchers to reroute certain calls regarding people experiencing homelessness to the community partners who can best address the human services needs of those individuals has that added value of enabling our officers to spend more of their time focused on those calls that, as Chief said, require law enforcement action. So this is a win-win for our community and a brilliant example of LPD's and our partners' commitment to ensuring the health and safety of everyone in Lincoln, and we're so proud of it. Thank you for tuning in.